CMS freezes new Medicare enrollment for home health and hospice providers. What seniors need to know. A major Medicare decision has just been announced, and it could affect how new home health and hospice providers enter the Medicare system. But does this mean seniors will lose their current care? Hello and welcome back. Today, we are covering an important Medicare update for seniors, retirees, caregivers, and families across the United States. The Centers for Medicare and Medicaid Services, known as CMS, has announced a 6-month nationwide moratorium on new Medicare enrollment for home health agencies and hospice providers. CMS says the move is part of a wider effort to fight fraud, waste, and abuse in the Medicare program. This story is important because home health and hospice services are used by many older Americans, especially people who need medical care at home, recovery support after illness, or end of life care. The key point is this: CMS is not shutting down existing Medicare home health or hospice providers. Instead, the agency is temporarily stopping new providers in these categories from enrolling in Medicare during the moratorium period. CMS says existing enrolled providers can generally continue participating in Medicare, submitting claims, and serving patients. According to CMS, beginning with the effective date of the moratorium, new home health agencies and new hospice providers will not be enrolled into Medicare. The moratorium is set for 6 months, and CMS says such moratoria can be extended for additional 6-month periods if needed. Reuters reported that this is an unusual nationwide action. In the past, CMS has used enrollment freezes in specific states or counties where fraud concerns were identified. This time, the pause applies across the country for these provider types. CMS says the purpose is to give the government time to review program integrity concerns and stop fraudulent providers from entering Medicare. The agency says the legal authority allows CMS to impose a temporary moratorium when there is significant potential for fraud, waste, or abuse involving a provider type or geographic area. For seniors and families, the most important detail is that this does not automatically cancel care from current Medicare-approved providers. CMS explains that moratoria typically affect new enrollment applications, not existing enrolled providers. Home health and hospice care are major parts of the Medicare system. Home health services may help people recover at home after illness, injury, surgery, or hospitalization. Hospice care supports patients with serious illness when the focus shifts toward comfort, quality of life, and family support. Reuters reported that in 2024, about 1.8 million Medicare beneficiaries received hospice care, costing Medicare $28.3 billion. It also reported that about 2.7 million Medicare patients received home health care, costing about $16 billion. Because these services involve large public spending and vulnerable patients, they have also been areas of concern for fraud investigations. Reuters noted that scammers may bill Medicare for services a patient did not need or did not receive. CMS has used moratorium authority before. Its own Q&A says that between 2013 and 2018, CMS imposed and extended moratoria involving home health agencies and ground ambulance suppliers in selected states and localities. However, CMS says the last earlier moratorium expired in 2019. This matters for three major reasons. First, it affects Medicare program integrity. If fraudulent providers enter Medicare, taxpayers lose money, and patients may be exposed to poor quality or unnecessary services. Second, it may affect provider access in some areas. If a community needs more home health or hospice providers, a nationwide enrollment freeze could make it harder for new legitimate providers to enter the Medicare system during the moratorium period. Third, it creates confusion for seniors. Some people may hear the word freeze and worry that Medicare home health or hospice benefits are being stopped. Based on CMS guidance, that is not what this action means. Existing enrolled providers can generally continue operating, and the moratorium mainly targets new Medicare enrollment applications. For seniors already receiving care from a Medicare approved home health agency or hospice provider, the immediate message is do not panic. This announcement does not mean your current Medicare home health or hospice care is automatically ending, but seniors and caregivers should still stay alert. If you are choosing a new provider, ask whether that provider is already enrolled in Medicare. If you are working with a hospital discharge planner, doctor, social worker, or care coordinator, ask them to confirm that the provider is Medicare approved. Families should also watch for red flags. Be careful if someone offers free services, pressures you to sign forms quickly, asks for your Medicare number without a clear reason, or claims you need care you never requested. Medicare fraud can affect both the system and individual beneficiaries. It mainly targets new Medicare enrollment applications. This decision has both positive and cautionary sides. On the positive side, stronger fraud prevention can protect Medicare funds and reduce abuse in sensitive healthcare areas. Seniors deserve care from legitimate providers, not companies created mainly to bill the government. On the cautionary side, broad nationwide action can create access concerns. Some communities may genuinely need more home health and hospice providers, especially rural areas, aging communities, or places with workforce shortages. The real question is whether CMS can use this 6-month period to strengthen oversight without creating unnecessary barriers for legitimate providers and patients. This story is still developing because the moratorium may be reviewed, extended, lifted, or followed by additional guidance. CMS says extensions or lifting of a moratorium are announced through Federal Register notices. To summarize, CMS has announced a 6-month nationwide freeze on new Medicare enrollment for home health agencies and hospice providers. The agency says the goal is to fight fraud, waste, and abuse. For seniors, the key takeaway is clear. This does not mean Medicare home health or hospice care has been canceled. Existing enrolled providers can generally continue serving patients. But families should be careful, verify provider enrollment, and stay informed as CMS releases more guidance. Do you think this Medicare enrollment freeze will help protect seniors from fraud, or could it make it harder for some families to find care? Share your thoughts in the comments. If you found this Medicare update useful, please like the video, subscribe to the channel, and share this information with a senior, caregiver, or family member who may need to know about this change.